I'm Dr. Berry, licensed psychologist, and here I share legal and entertainment news from a psychological perspective. I also enjoy putting out these general educational videos too that can kind of help when different milestones are coming up. So I did a video on back to school tips for kindergarten, elementary school, but really didn't get into those preteen teen tips. And so I wanted to make sure to do this video to focus on that here. All the resources that I'm going to talk about will be down in the description. There is a phenomenal book called Anxious Kids, Anxious Parents. And it was developed by Lynn Lyons, and she has a phenomenal um, hey everyone, thank you for joining. So Lynn Lyons has a phenomenal approach to treating anxiety in children. And she says, and as a psychologist, I can confirm that it's true. I've never met an anxious child and there not be an anxious parent. And that if I solely focus on the child's anxiety, then and not really talk to the parent, that's going to cause problems. So that's why I do these videos to talk specifically to parents about how they can help their kids talk back to their anxiety. Because when my child's anxiety comes up, it can trigger my anxiety. And as a good parent, I want to help my child with it. But sometimes the way that I help can actually reinforce anxiety and not help my child talk back to it. So I'll give you an example. A child that is nervous about the first day of school because let's say maybe they show up in their first period and then they get their entire schedule for the day. And let's say this kiddo is doesn't have an anxiety disorder or anything like that. That would be normal anxiety because anxiety wants certainty and control. And with certainty and control, those are two things that our world, there are going to be things that are uncertain. We have to be flexible. And I want to encourage flexibility. So I'll say it again. I want to encourage flexibility with my child. Anything that's inflexible is reinforcing that anxiety. And often with anxiety, the content can change. And when I say the content, so today it's worrying about the schedule. Tomorrow, it's the bus. The day after that, it's what's for lunch. Like there are all of these things that can constantly pop up. And I want to help my child embrace uncertainty, not knowing. And because let's say my child is concerned that they might cry in front of the class. That's something that might happen, and if they did, here are the tools and resources they have to cope with that. Just to help reinforce the fact that it would feel like the end of the world, but that things would be okay. So here, she has a podcast called Flusterclux, and this article is from 2021 specifically talking about school anxiety helping kids and teens. And it is very, very common for there to be some anxiety when we talk about going back to school. And sometimes that worry can cause serious issues like school avoidance and school refusal. And often it's the anticipatory anxiety. It's that anxiety about the things that haven't happened yet. And that's where practicing mindfulness, being in the moment. And the thing that I teach my clients is turning the what ifs into what is. Because often it's, well, what if this happens? And what if this happens? And what if this happens? And what if this happens? I encourage them to take a breath and let's talk about what is, what we do know, and then that we might have to embrace those things that we don't know. And kind of building that tolerance for uncertainty, which is the opposite of anxiety. All right. And so and there can often be changes in routine, and we're doing this a little late because this is Labor Day weekend. And so, if you have kiddos that are going back to school for the first time after Labor Day, I would go on ahead and start adjusting your sleep schedules now, because really you want to adjust sleep schedules about 3 days to a week before you actually need to do the transition. With the families I work with, we try to do it the week before, just adjusting that, and then we want to expect anxiety to show up. And what I mean by that is I know that that night before, probably going to need some additional support, probably going to sleep with the weighted blanket, might have a little trouble going to sleep, might have a nightmare about showing up to school, and I forgot my lunch, or I forgot something. The other day, we actually something happened, and I forgot to give my kiddo his snack. And in the past, if I had forgotten his snack or something last year, so for kindergarten and first grade, his teacher always had extra snacks. Well, for second grade, if you forget your snack, if you don't bring one from home, you just don't don't have one. And so I checked the book bag when we got to school. Oops, mommy forgot the snack, and I prepared my kiddo. Mommy forgot your snack. Nothing in your lunch is has peanuts in it, because for our school, snack has to be nut free. So I told him, I was like, if you don't finish something from lunch, because I packed him a really good lunch. I was like, if you don't finish something from lunch, you can eat that for snack. And he ended up being fine. Like, it was fine. I didn't have to think or stress about it for the rest of the day. I wasn't a hideous mom because I forgot to bring my kid his snack. I didn't go home because I could have. I could have went home and brought his snack to school. Now, if I had forgotten his lunch, because my kiddo does not do school lunch, I would have had to go back and get his lunch. But for snack, it was just like, oops, mommy forgot. Here's what we're gonna do about it. And everything was okay. All right. And so let's see. So we want to break those worry habits by doing something different. I wanted to pull up a different resource. Managing anxiety at school and home. I have this one down below as well. And these are podcast episodes, and I have found her resources and tips to be really really practical. Now, the one thing it does is it makes the parent also tolerate their child being uncomfortable. And if the situations where I've seen this cause the most difficulty is when the kiddo maybe also has some sadness, and so, or severe sadness, or if they have significant negative thoughts. I'm trying to talk around some words. I think y'all can kind of get what I'm talking about. If the child engages in some type of harm, that is normally the times when I feel parents wanting to step in to really protect and save even more, when really my goal as a therapist is to help give that child more resources and tools within the setup. And with giving the child resources and tools, that helps them be able to talk back to the anxiety. So instead of when my teenager comes to me and says, I'm worried that so and so is going to talk about me. We have no control whether or not so and so talks. So how are we going to manage it if so and so does? Like, how are you going to manage it? Like, what's going to happen if that's true? Like, and just managing things as they come, which is easier said than done. I will 100% admit this is much easier said than done, but these tools and tips work. There is also a website called Playing with Anxiety .com, and that one has a free download for kids and teens. It is the companion book to The Anxious Kids, Anxious Parents by Reed Wilson and Lynn Lyons. Lynn Lyons also wrote uh, a book for adults called Anxiety Audit. And I did a video covering some of the highlights from that book as well. But with school refusal, because this will come up where kiddos and teens, they will be so stressed that they just say, I just can't. I can't go. With anxiety, something that can come up is avoidance. And avoiding that thing that stresses me out makes that anxiety go away. So not going to school relieves me of that anxiety and stress about being at school, but the hard thing about that is that can lead to bigger issues like agoraphobia. And I'm going to do a whole separate video on OCD and agoraphobia, so obsessive compulsive disorder and agoraphobia. There is a YouTuber, and I will make sure to link because they have a channel and it's a therapist that has a whole channel. It's called OCD and Anxiety. So I will share this if anybody needs any of these tools and resources now. I checked out a few videos. He's a licensed therapist, and his entire channel is dedicated to OCD and anxiety. All right. Um, but with school refusal, um, if we're at the point where we're just thinking about not going, it's difficult to go. That's where trying to figure out, is there one safe adult? Because I need to try to get the child to the building. And then once they're in the building, I want to help them stay there. And if my child is having school refusal, I want to make sure that they're in therapy, that they're working with a licensed therapist that specializes in anxiety, that can help empower them with tools and resources that can work with the family. For younger kids, there's also a program called Space that I have linked down below as well. I think it's spacetreatment.com. Let me see if that's what it is. Space treatment. I'm almost positive. Nope. Wait a minute. Let me see. It is a parent support group, anxiety. Yes, it was spacetreatment.net. I said com and it was net. And what this program, it's supportive parenting for anxious childhood emotions. And this was specifically developed to help with anxiety, OCD, anxiety related problems. And the goal of this is to help if there's separation anxiety, social anxiety, generalized anxiety, fears and phobias, panic disorder and agoraphobia, selective mutism, and OCD. The parent is the one that participates in the treatment, and uh, I I know that these types of resources can be really helpful for families, because often parents are doing their best. They're doing what they think is right, and sometimes we can actually be reinforcing the anxiety and making things worse. And it is scary, because if you do have a child that when their anxiety gets so high that they engage in that harm, or if they become unsafe, that's where safety is always that priority. But then you want to have a treatment team around you to make sure that we're helping them gradually approach those fears, that we're not saying, okay, the bus makes you anxious, so we're just never ever going to take the bus ever again. And that's it, because I promise you, if we do that for the bus, next week it's going to be the cafeteria. Okay, you don't have to eat in the cafeteria, you can eat. And then next week it's going to be band class, and then the week after that, like, you're just going to keep having things come up, that because the anxiety isn't, that process is still there. And the underlying worry process is, I want to be comfortable. And it's helping kiddos tolerate discomfort, which is easier said than done, because that discomfort of, okay, I I don't I like I normally get this for lunch and they don't have it. I have to be flexible. And flexibility is very, very difficult. Shani, I'm glad you were able to be here. Um, And, thank you for sending this to your sister. I hope it is helpful. Laura, thank you for mentioning exposure therapy. So I personally do gradual exposure or systematic desensitization, where we come up with, where we gradually work our way there. I've worked with some kiddos that have been on homebound instruction, so I try to avoid homebound instruction at all costs. And in my state, what that means is if somebody's mental health is to the place where they can't access school because of a medical reason, and mental health is one of those medical reasons, a psychiatrist or a psychologist can write a note saying that they recommend a period. Normally we start with like 3 to 6 months, but like there's going to be a period of homebound instruction. But with homebound, in my state, the kiddos only get 10 hours of school with a licensed teacher a week. 10 hours a week. And outside of that, they're meant to do work that's sent home. And but they're often isolated because they're normally at home all of that time. And I've seen it create more issues, especially if there are issues within the home. Laura, I'm so glad that exposure therapy was helpful. It is hard, and I'm glad that you mentioned the hard part because it is hard to do those things that are uncomfortable. And I'll just give my own personal example. So, coming out of the Rona and the vid, what going back to being in person with no mask and people coughing and not immediately thinking when somebody coughs, "Oh my gosh, they just gave me COVID." Not like it was a process to get back out there. I went to a conference, I think 2020 2 was the first year I went back to being in person, and not in person for work, but going to conferences and traveling more and doing all of those things. Towards the end of 2021, beginning of 2022 was when I started doing those things more, and at first, because it was comfortable being at home. It was great not going anywhere. Like, not doing the things was was glorious. But then getting back out there, going back into stores, you know, having to deal with all the things that you have to deal with, those things can push our buttons. And so what the worry cycle does, what anxiety is our amygdala. That's our fight, flight, people please. Our brains are wired to survive. And sometimes something bad happens. So I work with people that have experienced medical issues that have resulted in some like medical trauma where getting medical procedures can be difficult, or people with needle phobias, and where for any type of procedures that it's really difficult for them. And we talk about them taking their, all the coping that they can do, relaxation and breathing. So that's one of the top ones that I recommend for people, because sometimes we use music or something like that, but I might not always have access to my music. I might not always have access to all those things, but I always have access to my breath. And so being able to breathe is so important. And so that's where it gives the kids the minimum amount of instruction. And I've had a lot of kiddos fall behind when they had things like that. And when I was little, I didn't like needles because my mom appropriately taught me body autonomy, and I didn't like shots. Like, they're like, "It's my body. Why do I have to get a shot?" Like, I'm like, "No, I don't want you to poke, and I'm not gonna sit here and let you poke me. Like, why would I do that?" So I used to have to be strapped down until I was in middle school. I would not sit and let them, like, I that I hated that. And often the fear of what's going to happen is worse than the actual experience of the thing. And if you tense up, it makes it hurt more, which is easier said than done. And so that's where gradually working up to breathing, not looking at the needle, because sometimes the size of the needle, you're like, oh my gosh, how are they going to get, how can that go inside me? Like, what? No, they shouldn't put that needle anywhere. But, so sometimes looking away, holding a parent's hand. I know for my kiddo, when he was little, we would, like he would sit on my lap, and I would hold his face away from it, and they would, give him the shot. He's always been a pretty much, like, and so I normally just kinda held him in my lap, and that's how he would get his. Um, but with that, b the needle, because sometimes we associate the needle with pain. And especially people that have veins that are difficult to find, or if they've had a bad experience. Because sometimes I've known kiddos that had to get stuck multiple times because the nurse or the staff was having difficulty finding the correct vein. And once you have a bad experience, sometimes that can make it difficult after. And that's where you have to work with somebody. And there are things that can kind of help you gradually get back into it. I take a dialectical behavior therapy approach with it where we try to balance both. Where, yes, I know you don't like shots. Yes, it might hurt. So if my kid asks, "Is it gonna hurt?" I don't tell my kid, "Nope, nope, it's not." I'm like, "Buddy, it might." "Buddy, I don't know." Like it might, but the reason why we're doing it is to keep you healthy. I actually have an old TikTok. I don't know if it's still there. Oh my gosh, let me see if I can. Oh my god, because my son's voice is in the background. For some reason, I was filming, because I was asking him how he was feeling, and he had just gotten a shot, and he was sad because he had to get a shot, and we were able to talk through, that it was to keep him healthy, and that's why, and it's okay that he didn't like it. That's okay. And hopefully he didn't need another one for a period of time. Yeah. So this does not surprise me that there was a bad experience at 11, and the body remembers. So while my brain might be like, "Oh no, it's fine," but then when I'm in that moment and that needle comes back out, it's almost as though the person can go back to that traumatic experience, and they're no longer in their, maybe let's say the child is 13, 14, 15. They're not in their 15-year-old self. They're back 11 years old in that bad situation. And so that's where doing some work around that. EMDR. So for somebody that's had a bad experience, sometimes eye movement, EM, desensitization, reprocessing, me and letters and names. So EMDR is a treatment that can be really helpful. Sometimes that's one where hypnosis, but if somebody was doing hypnosis with my child, I would be in the room. I'm just weird like that. And we're going to cover a difficult case. If you want to stay on for the court coverage, that's coming up next. But with court cases, like if my child was going to do some type of hypnotherapy, I would be in the room for it. Um, but yes, all right. Nightcat, welcome. Also, I've heard asking the patient to cross their toes. Oh, wow. Yeah. Sometimes cold. So cold can trigger a parasympathetic response. Um, Trying to give them as much control as possible. So ask, because let's say my child needs 2 shots, or like there's just trying to give them some little bit of control. And I agree. So for me, I'm not sensitive to those. Um, I'm okay with it, but I'm not a fan. Um, I'm not a fan all the time. So with school refusal, it's acknowledging, okay, yes, you're having difficulty. Now, if my child is actively being bullied, and if they're being bullied online, if people are saying things about them, that's where communicating with the school, if you need to, involve, because if people are making threats, like if things are getting unsafe, talking to your juvenile intake if you need to. um, I've had some people where the school that they were zoned for just wasn't the right fit, and we were able to get them moved to a different school for mental health reasons, because it really did get that bad at the school that that they were zoned for. And the school was really having difficulty keeping them emotionally safe. So safety has to be felt. And and so that's where if my kid truly isn't emotionally safe, if there really are people, and the staff aren't doing anything about it, that's where I as a parent have to help support. So that's where that anxiety would be protective, and that refusal would also be protective, and so figuring out ways to support. If I do decide that my child does well with virtual learning, with virtual education, let's say the last year was just hideous and I need to do virtual school for a period of time, I would still have them involved with friends. I would still have them involved in outside activities. I would still have them leave the house once a day. Maybe they go to the library to do school. If it's a homeschool group, maybe we're involved in a co op, but I would still make sure to get out because that helps break that cycle of the only place I feel safe is home. Because that's when you can get an increase in some of that anticipatory anxiety, that fear of the unknown, and that fear of being uncomfortable or in situations that might trigger my anxiety. So I like to tell the kiddos I work with, anxiety is normal. You're never going to have zero anxiety, never. Like anxiety is going to be around, and there are times when it can be helpful, and then there are times when it is like nagging. It's way too much. So the anxiety that's like nobody likes you, everybody hates you, everybody's talking about you. That type of anxiety is tormenting, and I definitely want to help clients work with that. But the anxiety that's like, "Oh, I don't want to be late." Or like there's sometimes that anxiety, I'm stressed about a test, but it's not to the point where it's impacting my ability to concentrate. Cuz anxiety is on this curve where there's a peak point where the amount of anxiety being a little higher and it might increase stress a little, but it's not to a point where it's starting to impact performance. And excuse me, and there is a point where the anxiety gets so high that it starts to lower a person's ability to think, concentrate. And with the phone bans, because that's a new thing in Virginia this year, where for middle school and high school, they're able to have their phones. For middle school, the teacher, they can't see the phones at all. They might be able to pull them out during lunch, I'm not sure. I know for high school, I think they can pull them out during non-instruction times, but that was a big stressor for because a lot of my clients, their phone is their coping. Like, this is what helps them cope. They listen to music, and there is something called a 504 plan. You do need a medical diagnosis of significant anxiety to qualify for a 504 plan. So I have some clients that have really, really high anxiety, and they do need to be able to have access to an MP3 player that has music, or they need to have access to music. They do have smaller testing because that's what's supportive. They do get additional time. So if they're not able to finish the test in the hour and a half, that they're given additional time because of processing issues. And but I never, the whole idea of giving kids an additional day to do an assignment, because what that feeds is procrastination. So for ADHD and anxiety, giving additional days for assignments often causes more issues. And so that's where we normally don't work on things like that. And so this is where I want to accept that there are some things that I'm not going to be able to control, and being able to know. So what I can control are my thoughts, my behaviors, my emotions. But what's out of my control is what other people do, what other people say, what other people think. I can't control those things, and being able to accept that, I think that that can be really, really helpful. If y'all have questions about this, please leave questions down in the comments. I do reply to comments either with a typed answer, or sometimes I will do a video response to questions. If you do not want me to highlight your comment in a video, please just ask me to, black out your name, or I don't know, but like if somebody doesn't want that, because if you ask a question, I will sometimes do a video and I cross post those on different platforms. And so, yes, yes. All right. Thank y'all for joining me for this talk about back to school tips. If y'all have more questions, please let me know. And then right after this, we're going to dive into a really, really difficult case. So if you're not in a space to stay with us for that one, no worries. But I hope you enjoy the rest of your day.